Good morning. My name is Joyce Connery, and I am the chair of the Defense Nuclear Facilities Safety Board. I will preside over today's public meeting. With me today are my colleagues on the board, Vice Chair Thomas Summers and Board Member Jesse Roberson. We three constitute the board. Having established a quorum of board members, this meeting will now come to order. Mr. Kevin Laskowski, the board's general counsel, will serve as executive secretary for the meeting. This meeting was publicly announced on June 24th, 2021 on the board's public website and subsequently noticed in the Federal Register on July 7th, 2021. This meeting is currently being broadcast live over the internet, and a recording and transcript will be available on our website in coming days. We decided to hold this meeting of the unique situation in which the Department of Energy found itself since the onset of the COVID-19 pandemic. We wanted to provide the department with an opportunity to talk through some of the challenges impacting their facilities and how they've addressed those challenges, and discuss plans to transition back to a more normal operating environment. Our morning sessions are not focused on any safety issues that the board has identified, which is why the board decided to discuss them in a public meeting rather than a hearing, which will be held this afternoon. I now turn to my fellow board members for their opening remarks. Mr. Summers, let's start with you.
I thank you, Ms. Connery. I appreciate everyone's participation today, and I really look forward to a productive dialogue to improve our mutual understanding of each other's views. I can't wait. Thank you again, Ms. Connery.
Thank you, sir. Ms. Roberson?
Thank you, Chairman Connery. I just want to thank all of the participants who came to contribute to the knowledge we're all going to gain today and exchange. I'm looking forward to the dialogue both this morning and this afternoon, and I have no further comment. Thank you.
Thank you. Now I'm going to offer my personal remarks, so not as chairman, but as a board member. And I want to start out this morning's session noting what I said earlier, that we're holding this meeting not because of any safety deficiencies that we or our staff noticed with regards to how the department in general or Savannah River in particular operating during the height of the pandemic. We wanted to have a discussion with EM and NNSA about the trade-offs they made and how they made their choices and communicated them, and what lessons learned and that can be gleaned from this unprecedented situation. Understanding how to operate in a constrained environment, what innovations were made, which should be carried forward and which should not be carried forward when we return to an unconstrained environment. These are all important discussions that we hope to have this morning. As I have said in other venues, we do not yet know the total impact that COVID has had on our workforce or on society as a whole. What we do know is that we were all profoundly impacted. And I want to acknowledge the men and women who work for the department and for the National Nuclear Security Administration and the nuclear enterprise for persevering through the difficult and uncertain times and carrying out their mission in the midst of a pandemic while worrying about their own families and loved ones. On behalf of all of us, I thank you for your commitment to the work that you do on behalf of the American people. So joining us today from the department to discuss these issues are Mr. William White, the Acting Assistant Secretary of the Office of Environmental Management. We also have Mr. Mike Budney, the manager of the Savannah River Operations Field Office. Finally, in a supporting role, we have Mr. Greg Sawson, the Deputy Assistant Secretary for Safety, Security, and Quality Assurance. I believe that they have a few words to say before we start our discussion, so I give it over to you, Mr. White, for your opening remarks.
Morning. Appreciate the opportunity to join you here this morning, Ms. Connery, Mr. Summers, Ms. Roberson. It's good to see all of you again. I appreciate the opportunity to talk about our program at EM and some of the challenges we've had over the course of the past couple of years. As the Acting Assistant Secretary for the Department of Energy's Environmental Management Program, I have the honor to lead EM's mission to safely and efficiently address the substantial environmental liability that exists across the EM complex and resulted from decades of nuclear weapons production and government-sponsored nuclear energy research that's played a pivotal role in domestic security and prosperity. Really, again, appreciate the opportunity to talk to you this morning, though, about the impact that COVID has had on the operations of our nuclear facilities. As a proactive measure to the COVID-19 pandemic, the department embarked on a comprehensive approach to deal with the impacts of the pandemic by establishing DOE policy and guidance starting in March of 2020. This guidance served to establish complex-wide communications, reporting, and development and implementation of response plans consistent with direction we were getting from the White House and the Centers for Disease Control and Prevention to address the pandemic. As the pandemic progressed and our understanding of the virus improved, EM continued action to protect the workforce at our sites by aligning activities in response to this understanding and to changing local health conditions. In March of 2020, at the onset of the pandemic, an ad hoc headquarters response team was formed in which EM participated to establish protocols for the department. From its onset, the response team was managed by the director of the Office of Management's Office of Industrial Hygiene and Safety at headquarters. By mid-March of 2020, DOE had transitioned to a maximum telework status for employees following OMB guidance. The department also established COVID emergency response preparedness and guidance, and despite the pandemic, the EM program continued to work to ensure the safety of all of our workers, to safely execute essential missions, and to maintain an effective federal oversight posture. EM required all field sites to review their activities, determine which were required for the maintenance of processes and systems that impacted the safety of the public or on-site workers, and to ensure they were complying with CDC recommendations and applicable state requirements to the maximum extent possible. Additional activities were authorized only after a review for the required implementation of COVID-19 controls. Outside community infection rates were also a factor in whether work was allowed. Over the course of the pandemic, EM has continued to rely on its dedicated frontline workforce to ensure the safety of our nuclear facilities, the security of our sites, and the necessary environmental monitoring and protection as needed for public safety. At EM headquarters, workplace safety plans were reviewed and authorized by myself and the EM Principal Deputy Assistant Secretary as a requirement before additional work was authorized. Throughout the pandemic, DOE federal oversight continued commensurate with mission essential work activities and ongoing operations to ensure implementation of safety equipment surveillances. As CDC and OMB guidance evolved, DOE continued to work to ensure effective implementation by its workforce. In March of 2021, for example, EM held a safety pause WebEx to provide information to all EM employees across the complex on the most recent guidance. Safety pause objectives were to review safety protocols, reinvigorate adherence to protocols, review CDC recommendations, address COVID fatigue issues, and discuss challenges associated with protocols. So I appreciate the opportunity, and I look forward to the discussion this morning as we work together to ensure the continued safe operations of our DOE facilities. Thank you.
Thank you, Mr. White. Mr. Budney, did you have opening comments as well? I believe you're muted.
Good morning, Ms. Connery, Mr. Summers, Mr. Roberson. Thanks very much for inviting me here today to have this discussion. I don't have any really additional comments beyond what Mr. White said, but look forward to having a discussion with you about how we, particulars to how we reacted to the COVID pandemic here.
Thank you. Thank you both for your opening remarks. And with the time remaining in this session, the board has some questions. And so I'm going to turn it over to Mr. Summers to ask the first question. Over to you, Mr. Summers.
Mr. White and Mr. Budney. Mr. White, I'll ask the first question to you. Early in the pandemic, the sites identified potential challenges associated with their ability to meet certain requirements, resulting in a 180-day relief memorandum from the Secretary, which was later extended. With regard to training and qualification, can you discuss how DOE headquarters assessed the risk and safety in determining the qualifications for which to provide relief in the secretarial memo? Thank you.
Thank you, Mr. Summers. That's a sort of a good question to start off with, I think, because what it does is it kind of highlights over the course of the past year and a half the constant look that the department has had to do at relative risk across the enterprise and thinking about how we manage operations in a pandemic environment. So as you're all aware, our approach for safety at all of our facilities is built on a lot of different things, from the way we do operations to the controls we put in place, but also the training and qualifications of the people who do work at our facilities. Very important component of ensuring that we have safe operations at DOE facilities. As we sort of looked initially at the training and qualifications that were coming up, we made a conscious decision that if you think about training and qualification, the point of, particularly for the recurring requalification and retraining activities that occur, these are things that need to be done at some periodicity to ensure that you maintain proficiency. But if you look at relative risk associated with letting them lapse a few months or a little bit longer in some cases, I think the marginal risk associated with that is quite low. When we looked in comparison, when we thought about how we were going to get folks involved and actually do the training, particularly for some of the training activities that required, I think most of you probably been through Rad Worker 2 training and other types of training like that require you to do them in a non-virtual environment in order to really be effective at the training. That training itself posed what we felt was significantly more risk than we would be accepting by allowing some amount of deferral of the training involved. Now, we did not know at the time exactly how long that deferral was going to be for, so I think you see that reflected in a series of memos that came out. And certainly the intent has never been to allow that to go on indefinitely. At some point, as soon as possible, we need to really unwind that. And over the course of the last year and a half, as we found ways to do some of the training in a way that we felt was safe, as we set up training environments that allowed for the appropriate social distancing at different sites, as we figured out how to do that training in a way that was low risk to the folks involved, then we tried to get that done right away and not simply take advantage of an exception memo, but do the training that we could once we felt we could do that training safely. So it was a little bit of a balance at every site. So when you go from site to site, you will see a little bit of a different perspective in terms of how they approached it. Depends on the type of operations they had, the type of training that was required, whether the site had the ability to set up the training in a way that could be done safely really quickly, or whether they needed to push that off. I think in general, the department has done a pretty good job of managing that over the course of the past 18 months. Certainly we have lessons learned in that regard. But at the end of the day, I think deferring or delaying that training for a short period of time in order to ensure that we could protect the folks who would have had to have been involved in doing the training in person was the right thing to do.
Very good. Thanks, Mr. White. Really appreciate your insights. Mr. Budney, the second question is for you, sir. And can you please discuss how the Savannah River Operations Office applied this memorandum that we've been discussing to any training and qualification requirements during the pandemic? And if you would, please note any current training and qualification exemptions and the methods used to minimize the need for them now. Thank you.
Right, so at Savannah River, we were initially issued a broad direction to the contractors to implement that memo authorizing the suspension of the qualifications and certifications because of the reasons that Mr. White mentioned, safety first for the people. And then we went about figuring out with the contractors exactly how we could manage this. And frankly, in most instances, because within several weeks, we had to bring back a lot of our staff because we have operating facilities which we could not have people absent from for a prolonged period of time. It actually enabled us to keep the vast majority of our operator quals up to certification standards. And so we did not fall behind in general in operator qualifications or certifications, with some exceptions, perhaps a person's health issue or something particular for individual preventative getting their practical experience factors done for their training. But then they were brought back in and cycled back in. It did slow down temporarily some initial training classroom. We had to have larger classrooms for about a month, but we've recovered from that in the most part. The only real impact for extended qualifications are in our emergency response area. We have hundreds of people qualified for both site emergency response and for facility emergency response. Even there, 66% of the site emergency response personnel were able to maintain their qualifications, and 83% for the facilities. And the letter of direction to the contractor specifies that they need to expedite and certify all those folks as soon as we bring the workforce back. We'll have to look at that letter and make sure it's specific on time limits there so we get everybody recertified. But it didn't have a big impact on operator qualifications. We were able to maintain most of the certifications.
all the challenges that I know that you went through. Really appreciate your insights and making sure you paid attention to the qualifications and training. Thanks, Mr. Budney. At this time, I'd like to turn over for the next couple questions to my fellow board member, Ms. Jessie Roberson. Ms. Roberson?
Thank you, Mr. Summers and Chairman Connery, and thank you to our participants this morning. Welcome. Mr. Budney, I'd like to just ask you a few questions since you're in the front line, really. Obviously, and foremost in your mind, as you've alluded to before, and also in our mind, is making sure you have sufficient staffing to carry out the activities that are important for you to do on a routine basis. So DOE establishes minimum staffing requirements to make sure that it can operate safely. And as we know, the pandemic introduced new worker hazards that could challenge the contractors, your multiple contractors' abilities to maintain those minimum staffing requirements. Many of these pandemic hazards and controls, like mask use and social distancing, were being identified at the federal level and evolved as knowledge and experience with the virus did. Normally, DOE formally incorporates requirements for its contractors into contracts and then relies on contractor safety management programs to identify and address new hazards. With SRS having multiple facilities under different contractors, can you describe how your office, your operation, oversaw consistent implementation of these new pandemic controls across the site?
Sure. So one of the duties that our management operations contractor has is the coordination of certain activities and providing services to all the contractors on site. And all the contractors sign up to certain site-wide procedures and operations. Emergency planning is one of those, and it includes our infectious disease response. And so all the contractors had to adhere to the infectious disease response plan that we had at the time. And of course, as the CDC guidance changed, the headquarters guidance changed, we amended that guidance and then promulgated it rapidly to all the other contractors. And therefore, as the guidance changed, whether it be, on June 29th, we implemented site-wide mask made mandatory inside all of our buildings on the site. And that was promulgated to all those contractors. We held weekly COVID calls with all the contractors and all the other tenant commands on the site. Everybody followed the same guidance from the Forest Service to every ecology lab to the private contractors that we have. They all followed the same. So we own all facilities, so they follow our guidance. The other thing we did to help us implement and verify that the procedures were followed, we have an infectious disease response team that was stood up as part of our infectious disease response plan. They coordinated the drafting and approval of all those procedures as we changed them, incorporating all CDC and headquarters guidance. And they also formed a team that if there's any indication that things weren't well, first of all, for any operations, changing the way they were doing business, or if we detected perhaps there was a problem anywhere, the infectious disease response team acted as our objective standard and went out and looked at those individual operations and verified that the standards were being implemented correctly. And so that coordination by the M&O contractor made it pretty easy to get those standards.
Thank you, sir. So if we take that and we focus in on confined spaces like in the control room, where sometimes you have limited space, you have a lot of personnel traffic normally, and a requirement or demand oftentimes for face-to-face communication. Can you tell us how DOE ensured proper implementation of the same pandemic controls or others and maintaining men staffing for control rooms? Were there additional considerations specific to different facilities, or did you have additional site-wide considerations specifically for confined spaces like control rooms?
We implemented the CDC guidance in the control rooms. We did put up some additional barriers. We paid attention to the ventilation systems in those areas to make sure they were properly aligned so that we didn't exacerbate any issues. Implemented social distancing. So it wasn't a special thing for control rooms other than some of those additional barriers we put up. Essentially followed to wear a mask, stay 6 feet away, social distancing, like the CDC guidance implemented, and then we verified those from the highest level. We did a lot of management field observations, and a lot of those field observations were specifically directed to ensuring the COVID protocols were implemented properly. I myself did my normal rate of management field observations to get out there and see personally that the protocols were properly as did. I think all senior management contractors.
Thank you, sir. And I guess my last question at this time is, having gone through what you've gone through and now looking forward where we are still to some degree in that transition, have you found the need for additional guidance as we move more of the workforce into a state of vaccination, as far as augmenting or modifying that guidance during the transition? Have you identified the need for any additional guidance?
We're following the guidance provided by headquarters. Personnel who are vaccinated aren't required to wear a mask or observe social distancing. However, folks who are not vaccinated are required to maintain social distancing. Or if they do not want to identify whether they're vaccinated, then they have to maintain social distancing. Wearing masks, this is the decision.
Thank you, Mr. Butney. Thank you, Ms. Connery.
Thank you, Ms. Roberson. So I'm going to go off, I'm going to terrify my staff and go off the script a little bit and ask a question, kind of a follow-on question to what Ms. Roberson asked before I go into my next line of questioning. And that is, Mr. Budney, you talked about following guidance that came from headquarters, following CDC guidance. We know early on some of the guidance was conflicting, and we have anecdotal evidence that, the COVID got spread in some places just because we didn't know what we didn't know at that point in time. And so fans were used or people were using the same telephone, what have you. How did you get feedback up to headquarters? What was the conversation like between you and headquarters about, hey, this is what we're seeing in the field, and this is where your operational guidance is, not going to survive first contact with my site for these reasons? Was there a good give and take, and how did that happen? Just out of curiosity, because you have the field experience and you're seeing these things up close and personal, and delivering that message back to headquarters and maybe having them adjust fire in terms of what they're giving as guidance seems to be a useful and helpful exercise. So can you just talk me through how that worked and whether or not you thought it was positive, and if there were changes throughout the COVID that occurred and how that conversation happened?
Sure. There was a direct line of communications me through EM3, EM2, EM1. If we had a situation, we did have one out in the remote area, and this is where we generally found those problems, where remote areas hard to get to, places where you couldn't just drop in unannounced. A lot of protocols to go through to get into the sites, and I would tell you the cases where there was an on-site issue, when we would send an infectious disease response team out to investigate those. I would tell you that the protocols perhaps were not implemented as well as we had hoped they would be. We were surprised by a couple of things. You mentioned the fans, and so we had to go look at it. It's particularly hot. Systems are during the summer here, pretty warm out there. These desk fans turned out to be a problem. We sent the lab out to investigate that. Write a very detailed lesson learned report about how those fans contribute to the problem. But the communications to headquarters were very straightforward. I call up Mr. White anytime and tell them, hey, this is what we got, this is what's going on, give them a heads up right away. If you have a problem, Anytime we had 2 or more cases in a single facility, we sent the infectious disease response team out and notified headquarters what the situation was there. And I tell you, one of the most helpful things is that headquarters sponsored a weekly COVID call for all the site managers, and all shared our lessons learned over that, what was going well, what was not going well. And headquarters pretty rapidly turned around guidance for we turned around to help us get things back in the box. So it was very open, clear communications between everyone.
Thank you for that. I think it's always helpful when the field can help guide headquarters if they miss or provide guidance that's not exactly useful based on what you guys see in the field. So for my next line of questioning, I want to talk about the transition back to, I don't know if you want to call it normal, the new normal. You guys have had operations throughout the pandemic, but obviously some of the restrictions are being lifted as you guys just spoke about with the vaccinations. It's things are changing. So there will be a challenge with people coming back and going back to the new normal. And I just wanted to talk, I want to understand from Mr. Bundy, from your point of view, when you look into the future and you look at this transition back, what should DOE and the contractors be looking at? And if you do enact, say, a more liberal telework policy, how do you manage minimizing the impact to DOE's oversight and the effectiveness and contractor safety management programs in the event that when you return to work that there is more flexible telework policy?
Well, whatever telework policy we develop will be based on individual positions. Facility representatives have far less telework than perhaps the IT department, for example. But throughout the pandemic and going into the future, the requirement will always be, because we have operating facilities, 2/3 of the contractor staff is still coming to the site every day. We expect the DOE staff to be on site doing their visual verification of the situation whenever they need to be to do that. So I don't really think telework from an oversight aspect will have a big impact. We've also been talking about this in terms of, if the contractor is having a in-person meeting, we would expect the DOE representatives to be there in person too, because you have to maintain that the teamwork environment that we developed out here between the feds and the contractors. While we do oversight, we adhere to the standards. There's also an aspect of teamwork that has to be developed so that we understand the situations and understand the environment that we're working in. If you don't go out in the field and see what it's like in August at H Tank Farm at 1 o'clock in the afternoon, and you start, letting requirements that don't take those physical conditions into consideration, then it won't be long before you have a real problem. Additionally, we'll have to have some presence just to help our own workforce. Since the start of the pandemic, we were able to increase our federal workforce from 213 to 232. Universally among those new employees, what I've heard is that getting the initial qualifications, the difficulty with having mentors and understand how those personal conversations with people has been a challenge for the new employees over the last year. So we're going to need some on-site presence to help new employees as we continue to bring them on board throughout the offering program. So those are the things we're watching carefully, how we maintain that teamwork environment, how we help new employees as they come on.
Thanks. So for Mr. White, DOE has identified lessons learned from the pandemic. How are these lessons learned institutionalized? How are they shared across DOE, the field offices, and the contractors? And did you see any differences in how those lessons learned were and will be applied going forward? And I think looking at it from a cultural aspect too, when folks come back, you have a very hardworking workforce, and people tend to go to work when they're not feeling well and just try to power through. We see that in Washington all the time. And obviously the lessons of COVID are perhaps you should not do that. And perhaps we should be a little bit more encouraging of people staying home when they're sick, for just for an instance. But can you talk about what the lessons learned are and how they were promulgated?
So the promulgation was done in a number of different ways, right? There wasn't any one specific method for communicating lessons learned. But I'll just walk through just a few of them because I think it kind of spans the spectrum. At least initially, one of the sort of the immediate focus was to ensure that we had really good communication across the organization. So for the first couple of months after March of 2020, we had, I had morning meetings with all of my senior staff. I had daily meetings with our field office managers at that point in time, instead of the weekly meetings. We had daily meetings across the department for the department's leadership team. Either myself or Todd would participate in those meetings. And so the primary point of all of those discussions initially, two things. One is to make sure that we were addressing issues that came up in a way that was consistent with the policy and guidance we were developing. And then also to make sure that we were sharing lessons learned in terms of obstacles or challenges or things that maybe didn't work quite as well as we thought they would work when we put them out. So I think that was a very important sort of informal way of sharing lessons learned. There were some cases where we saw something happen that was unexpected, and we felt it was important enough to capture that more formally. Some of the issues with ventilation that Mike talked about, we thought were important enough that the entire enterprise needed to see them in a sort of written form. So EM and NNSA worked together to put together a safety alert, laying out some of the challenges that we saw on the ventilation side to make sure the entire complex got those. Our contractors across the enterprise, I think, did a really good job of working together to share lessons learned. The Energy Federal Contractors Group, FCOG, got involved very early in trying to work together and share lessons learned. They put together their own lessons learned document, best practices across all of our contractors, and sort of helped in that regard. So really appreciated that effort on their part. And then there are things as we go forward, I want to try to make sure that we capture in policy or other space as we think about things that we learned that I wouldn't want to lose. Not just sort of things that we want to fix, but things that I think we did really well that I would like us to be able to continue to take advantage of as we move forward. Just one example of that, Mike talked about some of the challenges associated with onboarding new employees. And I think that's certainly something that we that in fact is a little bit difficult for new folks to get acclimated to an organization virtually as opposed to in person. But as we tried to work around that, particularly at headquarters, I think we identified some things that we would want to keep going forward. So for example, in Greg's group, some of the new folks that came on board, normally would have a peer group at headquarters who helped bring them up to speed in terms of the department's policy and approach and so the things that are important from a department or program perspective. As they stepped back and thought about this, if we have to do this virtually, you have access to more than just the headquarters folks, right? So as you bring safety folks on board and you think about working at a virtual environment, now we can involve all of our field offices in their cadre of mentors and help, right, in bringing them on board. And so I think it really expanded for new folks, their access to the organization. And so, as we think about this going forward, I want to be able to bring back the in-person informal mentoring as we can, but I also don't want to lose the idea that we ought to take advantage of the fact that we can operate in a virtual environment and expand that network to help new folks take advantage of expertise across the entire enterprise, not just what exists at headquarters. So things like that we need to work on capturing. Some of this has made it into the revisions to the department's policy and guidance as it came out. Some of our lessons learned on mask wearing and ventilation showed up in the March 2020 guidance that reflected what CDC had learned over the course of the past year. Other things we're working on as part of our reentry planning going forward. The department is currently very actively engaged in thinking about how we bring folks back to work, how many folks come back to work, and what phases they might come back to work, how much flexibility we allow for telework. And I think all of that needs to incorporate some of the lessons that we've learned that you talked about over the course of the past year. We're also thinking about, how do we address issues like training and qualification? How do we lay out clear expectations on unwinding some of the things and flexibilities we allowed over the course of the past 2 years where it was appropriate to do that. And then make sure we capture that in a way that provides some consistent guidance across the department or across EM. So I'm not sure if that entirely answered your question, so feel free to highlight if I missed something.
No, I thought that was great, and it's encouraging to know that you guys are going to keep the parts of the program that are useful as you re-examine, because we're looking at the same things as an organization ourselves, particularly the onboarding piece. We've had the same experience over the past year or so. So I want to turn it over to Mr. Summers to ask a follow-on question and then go into his line of questioning as well.
Okay.
Summers.
Thanks a lot, Chair Connery. Mr. White, really appreciate you explaining how you approach this pandemic that we've all had challenges and some great opportunities too, which you highlighted, which I'm pleased that you shared. I was curious as to whether or not the formal lessons learned activities that I believe DOE enterprise assessments undertook in the fall of 2020, whether or not there's been any follow-on activities to capture lessons learned institutionally by DOE, or are there any planned? Thanks.
I am not, other than the methods that I just talked about earlier, where we sort of, I guess, informally capture those lessons learned as we develop the guidance for how we operate going forward. I'm not aware of a specific plan from EA to update that lessons learned document. Greg, are you aware of anything?
Not specifically with the EA assessment, but we use that information particularly to inform our return to work plans, which are, as we mentioned, are still being laid out, and that would include the Defense Board case study that was done. That the information out of that will all go together in informing our return to work plan. I will point out as another example, with the pandemic, that gave us the ability to exercise to some extent our COOP plans, continuity of operations. And, I think we did identify that there were gaps in the level of planning that were done early on. And that since has been, upgraded. And we learned that, rather than have each site have their own specific plan, we needed more, robust guidance that our COOP plan could just point at. So we have made some revisions to the COOP planning, as a result of the lessons learned during the pandemic. And two other items that I think would be good to mention. The Federal Employee Viewpoint Survey this year was specifically modified to add, so how did we do with the pandemic? So we were able to collect a lot of good data on how the workforce feels that we did. And also, as part of returning to work, the government has conducted listening sessions with the employees, all done in small group and all rolled up, so that can also inform our return to work planning and what the future of work will look like. So there's been a lot of employee involvement in getting feedback and using that to inform our future plans. Thank you.
But I would say your point is a good one from a big picture perspective, though, because as I think about it, it may be worth a discussion with the FCOG folks, for example, to think about updating their lessons learned and best practices document in a few months once we're sort of through the return to work or reentry process. And then the same thing in discussions with the EA folks. I think there may be an opportunity in 3 months or 6 months to sort of capture the stuff that occurred between our kind of midterm look at lessons learned and then where we finally ended up.
Well, I really appreciate both of you expanding on that, and hopefully we won't have a pandemic to go through anytime in the near future, but we'll be better prepared, if so, by using some of these lessons learned for sure. I'd like to move on, Ms. Connery, in order to ask Mr. White and Mr. Budnia a few other questions concerning the pandemic, and specifically with regard to some of the emergency preparedness activities. So Mr. White and Mr. Budnia, as you are well aware, but for the benefit of others, throughout the pandemic, DOE largely reduced the scope of emergency preparedness, which Mr. White mentioned in his opening remarks. Reduce the scope of the emergency preparedness activities such as field drills and exercises in order to protect the workforce from the pandemic. This has challenged DOE's ability to ensure that emergency personnel remain both fully qualified and, importantly, fully proficient in their assigned roles. In lieu of field activities, the Savannah River site, like many other DOE sites, has depended upon virtual drills as a stopgap measure. So, Mr. White, with that said, my first question is for you, sir. Normal site work activities are resuming or have already resumed in the field, as you've discussed. However, emergency preparedness field activities are not yet necessarily commensurate with the activities prior to the pandemic. So, sir, what is your office's strategy in order to manage the risk created by uncertainty or declining responder proficiency, potentially, due to the reduction in the field activities and exercises? Thanks.
I think somebody from the system muted him.
Can you guys hear me now okay? Okay. Yeah, I'm not sure what happened there. I promise I didn't touch anything. Although I think anyone who's had me on video will tell you that I'm not necessarily the most proficient person at operating this video equipment. So, but I promise that was not my fault. So as I was saying, the issue with drills and exercises, I think, was a lot like the issue with training and qualification, where we felt we had to take a short-term, very manageable, I believe, approach to looking at risk for our emergency response programs in order to take a very necessary step to be able to manage the short-term risk associated with protecting the health and safety of all the workers who would have to be involved. And so I think that was a very necessary short-term trade-off for us to make. I will say that as I look at the data across the enterprise, I think we've actually made some progress in learning how to do these things, both in person and virtually, and to do them safely. And so if you look at across the sites, what we did in terms of 2020, where I think maybe about half of the normal exercises that we would plan to do ended up either being canceled or being switched into a sort of virtual environment. And you look at what we're doing in 2021, I think you'll see the department has already started shifting back to a more normal routine for the in-person exercises. I mean, part of it is a little bit about learning how to do the in-person things in a way that's safe, that allows for social distancing, that allows for the right controls. And as we're able to change some of the controls with vaccination being in place, I think that opens up opportunities and flexibility as well. But part of what we have to do going forward, just like with training and qualification, is make sure that as part of our, I'll call them reentry plans, but for lack of a better term, but whatever our plans are in terms of how to get from where we are right now to what, as I think either Ms. Connery and Ms. Roberson referred to as our new normal in 6 months or a year, how we get our emergency response programs back up to a normal standing has to be a part of that. And I know the folks in Greg's team have worked on sort of a white paper, guidance paper that kind of lays out with our field offices, how we might do that and what the expectations are. So that's certainly one of the things that we're working hard to incorporate into our planning, how to get back to a normal pace, because it is a very important activity. And I agree with you that proficiency is only achieved by practicing and doing it. And so there's no really great substitute for that. I will say, though, that one of the things, and it's not just for emergency response, but also for continuity, there are some things I think we've learned over the course of the past 2 years that are positive, right? And we don't want to lose those, because I think all of us have learned how to operate better and more effectively in a virtual environment. And I think that creates opportunities for us to actually significantly improve our continuity programs and our emergency management programs going forward, and thinking about how we use all of those tools that we've all learned how to become proficient at and incorporate them better into our normal preparedness processes. I think there's an opportunity for us to do that, and so we intend to do that as well.
Very good. very glad to hear you plan to incorporate some of the hard lessons learned to take advantage of those opportunities for the future. At this time, I'd like to turn over the line of questioning to Ms. Roberson. Ms. Roberson, over to you, ma'am.
Thank you, Mr. Summers. I'd like to just do a follow-up on that. I appreciate Mr. White's response. And I'd like to just go to Mr. Budney, who, you're there in the field, and, I'd ask you to just describe Savannah River specific. We know you guys are taking Herculean efforts to close these gaps, but can you describe the gap that you're addressing as it pertains to training and qualification of your emergency response operation, emergency response organization members, and what is your plan? And if you have timing, how do you see that gap getting closed? Are there changes you want to make to how you execute those requirements at the site? Just describe the gap for Savannah River and how you plan to close that for your ERO members.
Sure. As I said before, we have about 66% of our site ERO members have obtained their qualification certification. 83% of the facility folks have. So we do have a little bit of a gap to close. As we get the reentry plan from headquarters, then we'll sit down with contractors and figure out what the schedule ought to be to tighten up those qualifications, get everybody recertified in as short a time period as you can. A lot of the issue with maintaining those qualifications is actually participating physically in the drills, and so we'll have to sequence enough drills to cycle those folks through to meet that practical experience. I would tell you one other thing, though. One of the things we have to do here is build an emergency operating center, and so we're contemplating how to design that facility. One of the issues we recognized was that there may be situations in an emergency where key folks that we want to participate in the DOC can't get there right away. I learned this a long time ago when I was doing command control oversight when I was in the military, and trying to figure out how to tie in key decision makers who were in transit somewhere so that they could participate in decision making virtually. And we did sort out how to do that. But we want to do the same thing here. We want to have virtual capability to augment the physical presence of personnel in the OC. I don't think it replaces it because the data rate's always higher when you're face to face. You got everybody in the same room. So we're not looking to replace it, but a way to augment, especially over the short term. And this pandemic has actually afforded us the opportunity to concentrate to a great degree on how to develop what we call web EOC. And so we've been training our staff on how to execute emergency operations virtually. And we're going to incorporate those capabilities as we develop the replacement EOC so that if I'm on travel somewhere, I can still tie in and see what's going on if an emergency were to develop where we had to make the EOC. But I'm a long ways away, can't do that. Or even if I'm at home and it's a major storm, flooding, earthquake, whatever, and it's tough to get to the site for a couple hours, that you can get the key folks that you need engaged. So this, because we had to shift a lot of our drills to virtual, it enabled us to really start to concentrate on developing that capability and come a long way in development. That said, we executed about 72% of the planned drills in 2020, fiscal year 20. Right now through 21, we're to 77% of our planned drills. There is more of a focus on virtual drills, but we have started to get back into the field play. And we've been able to continue the facility field play. Anyways, it's trying to man that EOC and bring a whole bunch of people in there. It's a challenge. It's a tight environment.
Well, thank you, sir. It is good to hear that there are some experiences that are going to transition at the field level and hopefully continue to enhance your program, because I believe more practice means more better. So I'm glad to hear that. Thank you, Ms. Connery.
I'd just like to point out, though, that depending on virtual is also problematic, as connections drop, if there's severe storms, people's power goes out. I think we've all had that experience as well. So I think this is where defense in depth and redundancy is going to be really important if you are going to continue in the virtual environment for any of these important conversations, and certainly if you're doing emergency ops. So we've seen that on site in general with communications without even looking at it as a virtual communication, where the telephone lines or the radios don't work particularly well in an emergency situation. So I think this is a time where we have to make sure that our IT is specifically and well addressed and robust in order to make those things possible. So, Mr. Budney, I do have another question for you, and this is about when you do the drills and exercises as you ramp up, as people come back to work. We know that folks are coming back with kind of a different mindset, right? So there's a human factor of trying to recreate the muscle memory that may have been lost over the past year with some of these activities, as well as the challenges of still having the Delta variant of COVID and not everybody being vaccinated. Can you describe any of the changes that you've made or plan to make to ensure that any in-person drills or exercises are conducted both safely and effectively from both a COVID-19 and a human factors standpoint going forward?
Sure. Yeah, we're going to have to walk our way through some of those drills initially because we don't know precisely what the mix is going to be of personnel vaccinated, not vaccinated, who's got to maintain social distance, who doesn't. And so in the drill environment, we'll have to maintain the CDC guidance, maintain the social distancing as we go through that. It'll probably affect us a little bit in the EOCs. We get back in there and figure out how many people we can bring in, how closely they can sit together. So we're going to have to walk through that process as we start bringing folks back in. I think that's the best I can tell you at this point. We haven't brought that big team back in yet to do that. I would tell you the one thing though is just to make sure I was clear, the virtual stuff is an augmentation until you get the people physically in the room. Our primary response to any casualty still is as it was before, to get the people in the DOC, get the people at the facilities operate in person. So.
Thank you. I do understand augmentation only at this point, and also while we're still ramping up to go back in person. So I appreciate the clarification. Over to Mr. Summers for the next question. Mr. Summers?
Sorry about that. Thank you. I had to find a mic. Thanks, Ms. Connor. So, Mr. Budney, this is a question for you, sir. From an oversight perspective, it seems like it'd be difficult to be confident that the site will take the appropriate response in real-world events without many recent field drills or exercises to demonstrate the site's capabilities. How well do virtual and tabletop drills and exercises alone provide you in management confidence in the site's responses? Thank you.
Well, the operators in the field, the emergency response personnel, the fire department, the security forces, all those folks who actually have to respond in person, their regular jobs have continued throughout the pandemic. So I am confident that our security folks who respond, that the fire department folks who respond, they were the first among our folks to get vaccinated. So I'm not too concerned about the folks who actually have to physically go to the site. The operators, as we said, 2/3 of the personnel are in the facilities. We continue to do those actual drills in facilities, just not site-wide things. it's a question of getting the leadership re-engaged in a physical environment in the emergency operating center. The virtual drills help you maintain your theoretical knowledge, but the pace of events could be different when you're in person than you can virtually. We have developed, I think at WebAOC, they have up to 8 breakout rooms, so you can work items in parallel. But as you know, you kind of with one person speaking one at a time. When you go into EOC, we got the senior staff in one room talking about what we will do based on how events may unfold. The operations staff is running the event out in the main facility. The meteorological staff are running their piece, and it's all coming together much more rapidly, I think, than you can simulate in a virtual environment. So that'll be the thing that restore our proficiency in managing the information flow. It's a little more rapid.
Thanks, Mr. Budney. I do have a follow-on question, and it concerns, you had mentioned the innovation of the Web EOC, which sounds great, and I'll certainly look forward to looking into how you're implementing such an innovative technique to make sure that the proper decision makers are involved in all emergencies, accidents, incidents, etc. So obviously the IT as well as communications capabilities have had to increase. Is that something that, along with the cybersecurity concerns that have recently been in the news as well across our nation, are those IT, communications, and cybersecurity capabilities areas that you expect growth in order to use and leverage those capabilities for the future?
During the pandemic, we grew our bandwidth for the IT system tenfold. I don't know that for emergency services that we need more capability in that area than we have, but we'll continue to look at it. I know my IT folks always want to do a little bit more than they have in the past, which is good. They keep pushing us. And we certainly, the security concerns are not new to us. I'm the authorizing official for the cybersecurity system here at the site. We take it very seriously, and the team works constantly. Headquarters does regular inspections of our systems, assessments. So we've taken it very seriously on the cybersecurity. And if you had to ask me one thing that keeps me up at night, it's what's the next cyber threat? Is what we worry about all the time here, and make sure we keep the team. And that's a challenging area. It's particularly challenging in the personnel area to keep your staff because those are high-priced folks that there's a lot of demand for throughout the country.
Thanks, Mr. Budney. And if my fellow board members will indulge me for one more follow-on, because of the innovation that you've expressed with Web EOC and the other capabilities that you've expanded in IT, communications, et cetera, I was curious if you have or if you plan to share those capabilities and the information that you have, and I understand some of this is proprietary, but some of the Web EOC lessons that you've incorporated shared with that throughout the enterprise so that they can take advantage of the hard lessons that you've already learned. Thank you.
Yeah, absolutely. We actually have a biweekly call among all the site managers. And this is the sort of thing we share, and then we have routinely sent folks to other sites to tell them how we do a business in particular areas where we've enjoyed some success. So we'll continue that, including this Web EOC.
I'm glad to hear it. Thank you, fellow board members, and Ms. Connery. Ma'am, it's over to you for the next lines of questioning. Thank you.
Okay, and shocker, I'm gonna deviate again just because I had a question that came to mind for Mr. White. It has to do with the personnel issues with COVID, and there was a lot of folks who are facing a lot of difficulties, isolation, family members who are sick. And I just wanted to know if you had done any assessments with how many of your staff took advantage of the employee assistance program. We heard the numbers were up significantly across the federal government. And when you look at lessons learned, particularly since you have a lot of field operations underneath you with contractors who are also facing some of the same conditions, is there any lessons learned that you're going to implement with regards to how to support the staff that have to carry out these tricky operations while facing some of these challenges, both emotionally and mentally and at home?
Thanks. So just a couple of thoughts. I mean, certainly as we had our periodic meetings at the headquarters level or with field folks, one of the things we talked about was the importance of ensuring that employee wellness overall, right? I mean, as you pointed out, I think depending on the personal situation that folks are in, the last 2 years have been challenging for everyone, and for some people even more than others, depending on the their home situation relative to caregiving or kids in school and at home at the same time. And then other folks, people handle these sort of things differently, and so you would expect a spectrum of how folks respond. I have not specifically looked at employee assistance numbers. We certainly want to make that capability available, and we've taken action to continue to encourage folks and make sure that we communicated the availability of the program, along with the availability of things like employee concerns programs as well, and IG hotlines and other mechanisms that employees would have to reach out. I try not to try to leave the things that need to be confidential, because employees should be able to use employee assistance without concern that that's somehow perceived to be a negative thing. And certainly we want to make sure that it's available. I know we've talked at the site and field level about the importance of management walkarounds, looking at how folks are handling controls, and looking at behaviors associated with folks as they come back. Depending on your personality type, suddenly being reacclimated to an environment where you are in person working with 10 or 15 people when you haven't had that happen for 6 months or 12 months can be a little bit of a challenge. And I think that gets the importance of what Mike was talking about earlier about having management walkarounds and communication in that regard. From a department perspective, looking at the programs that I do monitor, like ECP, I haven't seen a noticeable uptick in the numbers of as a matter of fact, I saw the opposite and was concerned enough that we put forth a little bit of effort to make sure we recommunicated to folks the availability of those programs to encourage people to use them. I think some of the dynamics associated with folks working from home might have decreased the use of things like ECP, because some of the issues that would come up through that program don't happen when folks are working virtually versus working in person together. So I think that may have been a little bit of a part of that. So I'm not sure if that answers your question, but it's certainly a concern, and certainly something I expect all of our management team to be focused on, both the contractor and the federal workforce as we bring folks back. I know that, for myself and Todd has a weekly fireside chat with folks. So, every Thursday or Friday, Todd spends a little bit of time virtually with random folks in the EM organization, just letting them talk about anything so we can get a sense of what's on people's mind and what they're concerned about so that we can talk about it. I've had at least one EM-wide all hands every quarter. I'm trying to make sure folks understand what's going on. I think part of the thing with folks is making sure that we're doing a good job of communicating to people what we're doing, what we're thinking about relative to return to work and reentry at some point. We try to be transparent with all of that planning. As Greg pointed out, we've had listening sessions. I've had listening sessions with all of the headquarters folks. I've had them with some of our field offices, basically just open forums that let folks ask whatever questions they wanted, whatever's on their mind in terms of concerns or issues. And I think that sort of communication, that increase in communication is important going forward, because that's really the best way to deal with what you're talking about, is to be alert, be aware, and to be proactive about how we communicate.
And don't forget your extroverts. We've had a hard time.
Yes, and as an introvert myself, I try to keep that in mind, right? Some of us can handle social isolation a little bit better than others. So I do try to keep that in mind, that not everybody is the same.
Thanks. I just want to clarify too for the listening audience, because you used the acronym, the ECP program, which is the Employee Concerns Program, yeah. And so that's the one that saw the downtick. And the original question was about the employee assistance programs, which
Right.
is people reaching out for bereavement help for other issues that they may be having, or financial or otherwise. So I think you might have seen a seesaw with employee concerns going down, while employee assistance questions have risen across the federal enterprise as a whole. So back to my original line of questioning. Sorry for the detour, but I felt it was important to touch on that issue. So this early in the pandemic, the department, as you mentioned, the department and the contractors went on maximum telework, because that was the posture of the CDC guidance, the federal guidance, and your guidance. And as DOE established remote oversight capabilities for its program and field offices, it enabled DOE to protect its workforce while providing oversight. So I was wondering, starting with you, Mr. White, can you talk about how headquarters program offices have maintained their oversight effectiveness with the reduced field presence during the pandemic?
So from a headquarters perspective, a lot of the connection that we would normally have with the field offices has always occurred virtually, right? Except for the travel and the travel oversight to site. So on the headquarters side, there has been some fairly significant reduction in the amount of travel that our headquarters employees would do out to sites. The exchange for that is the folks at headquarters have sort of ramped up their participation in virtual activities. And across the board, I think we've demonstrated that we've been able to learn how to do virtual assessments, right? Whether it's a project management assessment or whether it's a safety assessment, we can do assessments virtually. I think there's a field component that's missing. I mean, one of the things that when I had listening sessions with the headquarters employees, one of the pieces of feedback I got in those listening sessions was that they thought that was one of the components that they really missed over the course of the past 18 months, was the ability to travel out to the sites, because there's no substitute sometimes to seeing things firsthand if you want to do oversight. And so I certainly got that feedback from our folks who normally participate in those assessment activities. Again, I mean, that goes with I think, I also got feedback that there's a lot that we learned in terms of how to do it virtually that we also want to carry forward. We got better participation in some of our assessment types than we would normally get. You get broader participation, you get the ability to bring more folks into them than you might otherwise have, and particularly more junior folks, in terms of having them participate and develop where they might not otherwise have done so if it were just a travel event. And so that part of it has been positive, but I do think folks have missed the ability to just two things. One, to be able to actually see the things that you're doing an assessment activity of. I think that really enhances understanding for folks. But there's also a component of doing an on-site assessment activity, as all of you well know, where everybody's kind of sitting in a room together and having a lot of ad hoc discussions about issues that come up and being able to work through those in a group setting that is really, really hard to duplicate virtually. And the feedback I've gotten is that our folks at headquarters really miss that activity. So as we think about reentry and return to work, I know one of the things that a lot of our headquarters folks are most excited about is being able to travel again, to actually get out to seaside operations and participate in some of these activities in person as opposed to just virtually.
Thanks. I think we've had a similar experience, although I think, Mr. Buddy, that means you're going to get a lot of visitors coming up once travel restrictions are lifted, and folks can travel freely, which is also can present its own problems if you have a rush to the field. So a similar question to you, Mr. Buddy, but I kind of want to understand how the field assessments were impacted by the policy over the past year, and the alternative methods that were used or considered for doing the oversight. So, for instance, relying on contractor assurance system metrics or performance indicators, any field ops that were recorded or walk downs that were done with cameras, and then using your FAC reps and how they were used for field portions of programmatic reviews, et cetera. So any insights that you can offer on that, I think would be really helpful for us.
Sure. Well, at the site level, actually, for our personnel located at the site, not a big impact due to the pandemic, more of we're impacted like the vital safety system assessments, more impacted by availability of qualified personnel and staff turnover, but not issues specific to the pandemic. Getting outside assessments done from whether it be IT or the enterprise assessments team coming down, we were missing having those people on site So we shifted to a great deal of virtual assessments for them, provided a lot of information electronically, and they continue to do those assessments. And then we engaged with the enterprise assessments EA team every 6 months to adjust schedules as we needed to, and so we did that as a routine matter to make sure that they could help us where we thought we needed assistance. The pandemic itself, not a huge impact. Getting people out in the field down here didn't require you having a lot of people in close contact to do those kind of things that you need to do in the field. So we were able to still continue ours.
Thank you. Mr. Summers?
Thank you, Ms. Connery. Mr. Budney, sir, can you please discuss any of the challenges or possible opportunities that you had with qualifying field representatives during the pandemic and how you addressed those challenges? Thank you.
Well, as I said before, we did bring on a number of new field reps during this time, and they did lack somewhat for having additional personnel on the site for those conversations that happen in the hallways, that sort of thing. But nonetheless, we gave them their qualification standards, and we didn't adjust the time limits for those, and brought people in as we needed to on a case basis to get their qualifications done. We are taking a hard look at who's assigned as qualification officers. That was a little bit of a challenge for them to get the system checkouts from folks, finding those people, determining their availability. If you can just walk by their office, ask, hey, you're on tomorrow, you had to make a specific email, phone call, that kind of stuff, try to track them down. So we do need some work in that area in a virtual environment, how we make sure those people are available. But we were fortunate in the hiring to bring on quite a few new field representatives with Navy nuclear experience, so pretty sharp individuals who know how to get qualified in challenging circumstances, and they're making great headway. And we have a number who are pretty near to finishing up and significantly improving our percentage qualified.
Thank you, Mr. Budney. I appreciate the explanation about qualifying the field representatives. This next question has to do with the appropriate number or presence of field representatives. If you would, can you please discuss how you've determined the appropriate facility representative field presence, weighing the risk to the workers with the risk to ensuring that the contractors are performing their work safely? Thanks.
Well, our field presence is provided by guidance from DOE standard 1063 on field representative. So we observe those standards and determine the number of field representatives we need to have. Of course, day to day, the number who are qualified, fully qualified, that we put in the field fluctuates based on retirements, folks taking on jobs, that sort of thing. We have been challenged in some of those, in some particular facilities, because the number got quite low. But we've made great progress here, and should be back up to a more acceptable level of qualification shortly.
Thank you, sir. For the next question, I'd like to turn the question or the floor over to Ms. Roberson. Ms. Roberson?
Thank you, Mr. Summers. And I think we should continue on along these lines. And we talked about facility reps, and we were able to see that you guys did bring on some new facility reps, and you did continue your qualification program. But I want to talk about the other safety functions that we pay attention to. Safety system oversight personnel, subject matter experts for safety management programs and management oversight. And Ms. Connery, in an earlier question, cited some potential techniques that might have been used to continue to ensure effectiveness with reduced field presence. But I wanted to ask you, for some of these other functions, were there specific techniques you used, and how were you able to maintain the effectiveness in these other safety functions with a reduced field presence? Mr. Bundy.
Yeah, I think that the field representatives where we had the shortage that affected us as far as system safety, nuclear system safety specialists and safety system oversight, we didn't have as big an effect in those numbers, although in both cases of the numbers we have on board, 42 or 44% of folks are qualified. But most of those folks who are qualified in both aspects, the nuclear safety specialist, NSS, or the safety system oversight, and rapidly improving that qualification status there. For the field reps, we had a couple of occasions where we used some support service contractors to augment as eyes and ears in the field for the facility representatives. However, no inherently governmental decisions made by those folks. They just went out and brought back data for the field reps to analyze, look at, and make decisions on. That was a temporary measure. We're not deploying that now because we've got a more substantial number of field reps back in the facilities, either in qualification or qualified. So we're not using that support service contract. And those were, some of the support service contracts we used. We tried to use retired field reps, folks who had been qualified with great experience, was augmented over that temporary period.
Okay, thank you, sir. So you're not using contractors anymore at this point. Is that what I understood? To augment?
That's correct.
Okay. Did you guys use virtual oversight in any form? We know that's a tool we've heard about in different places. Did you guys use any tools like that? Enhanced oversight?
No, not really. The best example we did was we got a great UAS system down here run by the lab, and we used to have to take people out in the field to verify the status of a lot of operations out there, sites that we remediated, that sort of thing. And we've employed those unmanned aerial systems to do that kind of work. We would take them, bring back, and show them material to the other regulators who are involved, DPEC and EPA. Tremendous savings in time and energy and dollars to do that work that way over those large areas, but not virtual inside facilities.
And really, one last question, if I can. Fully understand during COVID, because of the people impact, you use contractors. So as your workforce in these specific safety oversight areas have returned to work, is there I don't mean it in a bad sense, but more of a goodwill on your qual card from field observation? Is there an emphasis in ensuring that if you're a safety system oversight person, you spend more time refamiliarizing yourself with your systems and your facilities early, or is it just a catch up as time goes on?
Well, I'm not aware that we adjusted the qualification programs for anyone. And to be clear, there was never a prohibition from a safety system oversight personnel or a nuclear security specialist from coming to the site if they needed to do something at the site. It was just a matter of don't come to the site just to sit in the office. So they were still required to come in, and if they had to verify a system or component, something in the facility, they still were required to come in and do that.
Thank you, sir. Ms. Connery?
So I have a question, I think, with regards to, you both mentioned, I think Mr. White and Mr. Budney, but particularly Mr. Budney, how you onboarded a lot of people this year. And I will tell you that we have done the same thing. And I was just wondering, in other industries, in other parts of the economy, we're seeing people who we weren't expecting to leave the workforce or to retire to do so, and COVID kind of nudge them out the door. So I'm wondering if you have any thoughts, and you might not have the statistics in front of you, about how many individuals have kind of left the workforce, both at the site and at headquarters, in terms of turnover, because that's a lot of experience that's walking out the door. And, you know, they've always warned us about the silver tsunami, and COVID could be considered a catalyst for folks leaving the workforce. And I just wanted to understand whether or not you've noticed that at all, or if the onboarding and the new employees were simply to fill gaps that you had previously. And we can start with Mr. Budney and then go to Mr. White.
So our employees, attrition, I think, has been pretty normal during this period. And the extra folks we brought on were because we just had difficulty. Until we got that direct hire capability, we had difficulty filling roles. But with direct hire, we were able to rapidly hire personnel. We are a little concerned that we think we have a few individuals who haven't identified that they're going to retire, but may, when we execute a reentry and have to bring folks, ask folks to come back to the site on a regular basis. There may be a small there in retirements, but we haven't seen a big move as yet.
Well, that's probably good news. Mr. White?
So, I mean, I would agree with Mike's characterization of the past 18 months. I think our attrition rates, if anything, maybe have been a little lower than they might otherwise have been. But I don't think we can project that going forward. I would have the same concern that you would going forward. I mean, I think there's two things. One, there's the sort of the silver tsunami effect you talked about, where, you know, we have a fairly large percentage of our workforce that will become either already are or will become retirement eligible over the course of the next few years. And then, you know, and this is just sort of based on my own intuition and no real data, but my sense is that over the last couple of years, a lot of folks who may have thought about retiring or thought about leaving did not do so due to the uncertainty associated with sort of operating in a pandemic environment. And that once we get to the return to whatever, you know, normal looks like in 6 months or 9 months, then they will have the data at that point to make decisions that perhaps they put off for the last 18 to 24 months. And so I'm a little bit concerned that we will see our attrition rates go up significantly for that reason. I mean, I have no reason to, other than just intuition, to think that, but certainly something that we're watching very, very carefully. We have a number of, you know, sort of look at staffing across the board and look at hiring and vacancies, and, you know, our HR systems can only handle so much capacity in terms of hiring. And so, you know, we have to sort of think about how we prioritize that and how we work to incentivize and keep people in the program going forward. Certainly one of the reasons that for EM is I get feedback from the listening sessions I talked about earlier, and the feedback flowed up from the listening sessions Mike has had with his team and the meetings I've had with our folks in the field. And as we think about what the policy looks like in 6 months or 12 months in terms of the flexibility that the workforce would have for telework, where we can get the mission done and allow for telework and remote work, I think one of the things that we would lean towards is allowing as much flexibility as possible, right? To make sure that we encourage folks to continue to look at the EM program as an opportunity that they would want to continue participating in. And I think you're going to see that across the country. I don't think we're particularly unique in that regard. I think if you look at what other large companies and other government agencies are doing, I think you're seeing the same thing in terms of increased levels of employee flexibility. And exactly how much flexibility depends on what the nature of the job is and whether folks can get the job done with remote work or telework or not. So certainly something to watch for. And again, I don't have any hard data that would tell me that I know I'm going to have a problem, but just sort of intuitively, I would expect that it's something we should be on the lookout for.
Yeah, I appreciate that. I think my intuition is similar to yours, and I think we have to be very careful about capturing the expertise of the individuals that may be on the path to retirement, and, you know, obviously we've been doing a lot of recording of trainings, et cetera, because of being on a virtual environment that we hope then we can give to new employees as they come on. But with you all having field work, the experience becomes a lot more important in terms of individuals who are very familiar with your systems and how they operate, as well as your administrative controls, et cetera. So there's more of a challenge of human error, I think, in the field ops than probably in some of the desk jobs that some of us sit in right now. So we do look at that with a little bit of concern. Mr. Summers had another question on the emergency preparedness and response. I want to turn the floor over to him for a moment.
Thank you very much, Chair Connery. Mr. Budney, we've talked about several different instances of the challenges that have gone along with in the COVID environment and the pandemic and trying to do exercises in order to maintain our emergency preparedness proficiency. So I was curious, when do you anticipate resuming evaluated emergency preparedness exercises at the facility or at the entire site level? Thanks.
Mr. Summers, if I could, I'd like to get back to you with the details on that because the team has been working on the plan. They have a draft of plan on how they want to resume that. It depends on the reentry plan that we see from headquarters. So I don't have the dates handy now. I tell you, we're going to do it just as quickly as we can, but I'll have to get back to you on the actual dates.
That sounds good. Thank you.
So just for the benefit of our executive team and for our legal team, I just want us to note that we're going to take that as a question for the record. So Mr. Budney will get back to us on the answer to that. And then Ms. Roberson, did you have any other questions that you wanted to ask at this time?
I do not. Thank you, Ms. Connery.
Mr. Summers?
I don't have any further questions. Thank you, Ms. Connery.
So I just have one more question for you all, which is, so this is kind of like a wrap-up question. We'll give each of you a chance to wrap this up, but were there any pandemic impacts to your oversight that you have identified? And if so, how did you address them? So that's kind of the global question to all the questions that we've been asking so far with regards to the impact of the pandemic. And we can start at headquarters this time. Mr. White.
So from a headquarters perspective, I think the kind of the overall impacts are the ones I talked about earlier, where just a couple of areas. One, the participation by headquarters folks in field assessment activities has been limited over the course of the past 18 months. That's not something I would want to continue indefinitely. I think the folks at headquarters need to get out into the field and have a better understanding of what's actually occurring on the ground at sites. And so, from my perspective, looking at the headquarters team, I think that's the biggest impact from an oversight perspective that I've seen over the course of the past a couple of years. I think a little bit of that is offset again by sort of our improved ability to use virtual assessment activities. We've even done things like have virtual readiness assessment activities in a couple of limited cases that have sort of been interesting case studies in how to do that. But at the end of the day, there's no substitute for some of these activities for doing them in person and on the ground. And that has certainly, from a headquarters perspective, been our primary oversight impact. I'll leave it to Mike to talk about the field oversight impacts. My sense is in discussions with all of our field office managers routinely on this, the type of assessment activity that would involve FRs and SSOs getting out into the field, observing and walking down operations has by and large continued. And folks have been able to do that safely and successfully in large part. I suspect some of the larger group assessment activities that might have been more focused have been more challenging and more difficult, either because the types of operations they would look at weren't necessarily occurring, or because some of the resources you would fly in to support them from other sites or other parts of the department weren't available to do that and would need to participate virtually. But I'll defer to Mike to give a more detailed answer on that.
Sure. I think the one aspect that has concerned me is because we don't have all the folks on site as we normally do, It's making sure that the folks doing oversight, especially the new people that we're qualifying, understand the culture of our operation and how to maintain that culture, how to work constructively with the contractor while holding them to the standards. Bring people in that come from different environments, which may be different than the way we operate here. And we want them all to fall on to work in a cooperative environment we have established here that enforces the standards, but doesn't end up with personalities getting in the way of getting the job done or confrontations, that elevates disagreements to the right level so that we can make a clear decision, everybody's aware of what's going on. And you miss that a little bit, get people inculcated into that kind of environment. We don't have enough interaction with them on a personal level. So I think that's the one area, but for the most part, folks have been able to get out there in the field and do the oversight and compliance requirements that we do.
Well, I want to take a moment to thank each of you for participating in this morning's discussion. Mr. White, Mr. Budney, Mr. Sawson, I do appreciate your time and all of the work that you and your team have done in a very difficult situation over the past many, many months with the COVID situation, while maintaining the operations of the facilities across the complex and keeping the country safe. So at this time, we're going to take a break before we continue with this morning's session, which will be with our colleagues from the National Nuclear Security Administration. So we will break for the moment, and we will reconvene at 11:15, same bat time, same bat channel. So we'll see you all there.